Hello and welcome again to this channel where we talk about the basics of medical information making a big difference. Kindly, if you are new here, consider to subscribe. And if you are a returning subscriber, thank you so much for always checking on this channel. My name is Rebecca Morangi. In the next few minutes, we are going to look at complications of acid, reflux, and Gerd. Acid reflux can cause many complications. The first one being what we call esophagitis. Esophagitis is inflammation of the inside of your esophagus. Chronic pain can happen on your chest. Also, you can have difficulties when you swallow. Some may have what we call heartburn and also what we call food impaction. Food impaction, actually this is where you feel that there is some food stuck in your throat. So esophagitis can cause all those symptoms: difficulty when swallowing, painful swallowing, chest pain, heartburn, and food impaction. Another complication of GERD or acid reflux is what we call Barret's esophagus. Barret esophagus actually is the name for intestinal metaplasia of the esophagus, which is a precancerous condition. It means the tissues lining your esophagus change to look like the intestinal lining. This change happens after a long exposure of acid and inflammation. This can be a risk factor of what we call esophageal cancer. Another complication is what we call esophageal stricture. Esophageal stricture is narrowing of the swallowing tube, making it difficult to swallow. If you can look at a rough sketch down here, this is the esophagus where the food moves down, and you can see some narrowing here, and this is what we call a stricture. Downwards, you can see this is a stomach. Now here, your esophagus has developed what we call a scar on this tissue of the esophagus. And basically, this scar, actually, it protects you or someone from the chronic inflammation or injury which has been caused by this acid reflux. And this scar automatically will cause the narrowing of the esophagus, which can make it difficult during swallowing. And you will have a hard problem when you eat something or when you drink. I believe you have understood to what we call esophageal stricture. Another complication is what we call Laryngopharyngeal reflux. This complication is when the acid sneaks up into your throat while you sleep. And this acid will cause a swelling on your esophagus. Sometimes it can make someone to develop what we call hoarseness. Maybe when you speak out, your voice is not that clear. Also, somebody can develop vocal cord growths. And you can also aspirate acid particles into your airways. Last complication is what we call asthma. Some people wonder whether there is a connection between acid reflux and asthma. Oh yes, there is. Remember, asthma is a respiratory condition. When you have chronic acid reflux and you happen to have asthma, this can worsen the asthmatic symptoms. Asthmatic symptoms like chronic coughing and having difficulties when breathing. But for those who may not have this asthma, if you have chronic acid reflux, it can cause this coughing and sometimes difficulty in breathing. So there is some connection between asthma and having chronic acid reflux. Up to this point, I believe you have gotten the complications of acid reflux or Gerd. We have looked at what we call esophagitis, which is a chronic inflammation of the esophagus, which causes difficulty in swallowing, pain during swallowing, chest pain, heartburn, and what we call food impaction. We have looked at Barret, the esophagus lining turns and looks like the intestinal lining. And also we have looked at esophageal stricture, which is a scar formed on your esophagus. And we have looked at this structure to understand more. This is the scar. This is the esophagus where food moves down into the stomach. And this scar, we have said, it develops, actually sometimes it develops to protect you from the inflammations which have been caused by this acid reflux. We have looked at Laryngopharyngeal reflux, which is the acid sneaking up through the esophagus into your throat while you are asleep, which can cause swelling, hoarseness, and a growth in your vocal cord. And lastly, we have looked at asthma, and we have seen there is a connection between asthma and chronic acid reflux. Asthma being a respiratory condition. Up to this level, I believe you have gotten something. And since we started, we have come through some sections which you can be able to connect and get to understand more. This basic information can help you all help your loved ones. And when you are equipped with information, we always know information is power. Yes, you may not be able to treat yourself because you may not be a doctor. But after getting all this information, you can be able to look for help from specialists. Thank you so much. Let's continue learning. Let's continue equipping ourselves with information. In the next video, we are going to look at how these conditions are managed, or what is the treatment of this acid reflux and Gerd. Thank you so much, and let's meet in the next video. Bye bye.